Welcome to the Spine Care Expert Panel, a podcast series part of SpineCloud International. SpineCloud is a global, any-device digital training and networking platform built by spine care experts for spine care providers serving the world of spine disorder sufferers. Our vision is to change the very nature and structure in which spine care is delivered throughout the world. We want to see fulfilled, confident, and increasingly skillful spine care providers. We want to see these providers deliver better, people-centered spine care, and most of all, we want to see patients experiencing high-value care with which they are happy, which doesn't break the bank, with successful outcomes, and which empowers them in self-care. The bottom line, through a digital high-performing network on the cloud, we are growing evidence-based, patient-centered spine care with a focus on the patient as a biopsychosocial being. Plug in on spinecloud.org. To kick off this episode, I want to introduce one of our spine experts, Dr. Brian Justice, and play a couple of comments by Dr. Scott Haldeman, as well as give you a 60,000-foot view of spine care. My name is David Payton. I'm a chiropractor in South Africa. So we start right at the top with Dr. Scott Haldeman. Dr. Haldeman is unquestionably the world's polymath of spine. The synthesis of his academic accomplishments as a chiropractor and neurologist, together with his interprofessional and cohesive leadership skills and abilities, have absolutely revolutionized how spine-related disorders are perceived, studied, and treated throughout the world. Here's Dr. Haldeman talking about the global significance of helping your neighbor with back pain. The first clip is from a presentation he did in Botswana at the World Spine Care Conference, and basically covers the problem of spine as outlined by the World Health Organization's 2010 Global Burden of Disease project. The second clip, which comes immediately after, weighs in on the significance of serving people with spine-related disorders. This clip is taken with permission from a telephonic interview he did on the Mechanical Care Forum podcast, run by Jason Ward, a certified McKenzie physiotherapist in private practice in Memphis, USA. You can visit the Mechanical Care Forum at mechanicalcareforum.com.
First statement they make is that musculoskeletal conditions such as low back pain, neck pain, and arthritis affect 1.7 billion people worldwide. MSK conditions have a greater overall impact on health of the world population, considering both death and disability, than HIV/AIDS, all tropical diseases combined, the forces of war and nature combined, and all neurological diseases combined. For a neurologist, that's bad for our business. The second point is that the increase in DALYs from musculoskeletal disorders increased by 45% between 1990 and 2010. If we just now look at spinal disorders, low back pain was the single leading cause of disability worldwide, caused more disability than any of the other conditions they looked at. 10% of all disability is caused by low back pain. And neck pain was number 4 in the list. Low back pain is the 6th most important contributor of the global burden of disease. That's both deaths and disability. Then malaria or tuberculosis, preterm birth complications, chronic obstructive lung disease, diabetes, or lung cancer. When you combine neck pain with low back pain, you then find that the impact or the burden is second only to ischemic heart disease in its impact in the global burden of disease. Back and neck pain combined have a greater impact than HIV/AIDS, malaria, lower respiratory infection, stroke, breast and cancer combined, Alzheimer's disease, diabetes, depression, or traffic injuries. And what is the concern is that the global disease burden has shifted away from communicable diseases to non-communicable diseases and from premature death, as we've gotten control of this, to years lived with disability, compared to a similar study in 1990. So there's a move in emphasis from death from premature birth and infectious diseases to non-communicable diseases and diseases causing disability. For most of our lives, at least I didn't for most of our life, have any consideration of this huge impact of this thing I'm doing, that disorder I'm trying to treat. Mm-hmm. And when it became obvious that this is a major, major health burden on society everywhere in the world, it started to put things into perspective and started to let us realize that, or let me realize that most of what I'm doing is not just helping, my neighbor with back pain. Mm-hmm. It's actually trying to reduce the global burden of disease. And I think that most people, most clinicians who treat people with back pain, do not accurately comprehend how important their work is.
Mm-hmm. Isn't that so significant? Bear in mind that this is commentary from the polymath of spine, a man who has observed spine from both the mountaintop of academic observation, as well as from the front lines, from the trenches, as a clinician, as a chiropractor, as a neurologist. And so as you are within the four walls of your own practice, helping patients, helping your neighbor with back pain, you are fundamentally reducing the global burden of disease. Keep that in mind, keep it in heart, and serve your patients. So following on from this, I'd like to introduce Dr. Brian Justice. He's one of our senior partners. And I asked Brian if he would just introduce himself, tell us a little bit more about what he does, and he expands in a very helpful way on these principles that we've just heard from Dr. Haldeman. Here's Brian.
Hello, I'm Dr. Brian Justice and a founding member of Spine Care Partners. I've been in practice for 28 years as a chiropractor in a variety of care settings, including private practice, multiple hospital settings, and being embedded in industrial settings as well. This gave me a really interesting learning laboratory of how to optimally integrate evidence-based spine care into healthcare systems. This ultimately led to me being a co-developer of a spine care pathway. And this in turn led me to my current career as a medical director for Excellus Blue Cross Blue Shield in upstate New York. I've co-authored a couple peer-reviewed publications on the primary spine practitioner model, seeing it as a logical solution to the spine care gap seen in many communities. The impact of spine-related disorders goes way beyond the tremendous costs of care and the indirect costs of disability and lost productivity. But the spillover effect of increased pain and less function have a tremendous impact on many of the other chronic disease states, such as cardiovascular disease, diabetes, and depression. However, there's a positive flip side to that scenario. Back and neck pain offer a teachable moment not seen in many chronic disease states. It's easier to actually engage patients who are in pain to, say, quit smoking, lose weight, exercise, practice mindfulness, eat healthier, all of which help in a speedy recovery of their back and neck pain, as well as aiding in preventing future episodes. But these same lifestyle changes also have a dramatic impact on cardiovascular disease, diabetes, depression, and most of the high-cost chronic disease states that are impacting so many of our societies. The teachable moment of back and neck pain can serve as a springboard in patient self-care at many levels. The opportunity and the impact of practitioners to practice evidence-based spine care in a biopsychosocial construct is huge. The ability for an individual practitioner to have a major impact on the health of their community has never been stronger.
Thanks for listening to this episode of the Spine Care Expert Panel podcast series. Next week, we'll dig a bit deeper into Dr. Haldeman's view of the classification of spine-related disorders and the impact this will have on research and clinical practice. And together with this, we'll be looking at Dr. Haldeman's toolbox, as well as the supermarket of spine care services that is currently available to patients. We aim to release a weekly podcast in which we will pick the brains of leading experts in the world of spine. Send in your questions. Until next time, we are yours in spine, David Payton and the SpineCloud International team. Visit us on spinecloud.org.